Hi, I'm James from Cauchy Analytics, and we are building the world's first analytics platform for medical imaging. So here, I can show you that ultrasound is getting smaller. This represents the state of the art. It's a Clarius point-of-care ultrasound, and for the first time, a doctor might be able to have it in their pocket and investigate any heart or system they need to in the hospital at a glance. But this is not continuous, because continuous monitoring is still invasive. So patients are charged about $3.6 billion a year in North America for these invasive procedures. And if they're unlucky enough to get an infection, the hospital's on the hook. And that represents an $18.7 billion problem for hospitals. So let me introduce you to the future of medical imaging and monitoring. This tiny little thing is the Cauchy Analytics ultrasound sensor. We've miniaturized it and automated it so it's controlled by software so it can collect patient data and improve patient outcomes. It's real-time, continuous, non-invasive, you can reuse it, and it is very adaptable. What I mean by that is we can intend to use it in intensive care units, ambulatory surgical centers, operating rooms, emergency rooms. It can measure the heart, the lungs, the liver, the intestines, the bladder, the kidneys, all of it. We're going to focus solely on cardiac hemodynamic monitoring, because we know it's a hair-on-fire problem for the hospitals, and it represents a $1.1 billion revenue stream per year for our product. But let me tell you about the really cool thing. Because the hardware is going to be controlled by software, we only have to deploy a software update to have it do anything else. And in that time period, we're going to be collecting a lot of data. And who needs data but medical imaging AI companies? So we intend to license our platform to anyone who wants to develop software and join the medical AI community. We're building the first analytic platform for medical imaging and monitoring. So let me introduce you to our team. I am James. I'm an applied mathematician. I'm a PhD candidate here at the University of Waterloo. My co-founder Mosey did his PhD in ultrasound engineering at Waterloo and is now a postdoctoral fellow. And we got a doctor. His name is Rakjit Shetty. He's an intensivist at the Springfield Clinic in Illinois. So we joined the Velocity Incubator full-time on January 3rd, 2023. It's a date that I remember in my head, well, because I have a big smile on my face, and I still do to this day. But in that time period, we managed to collect 25 letters of intent. We interviewed 50 ICU nurses. We managed to build and test the first working prototype to prove that our miniaturization theory will work. And our most proud moment was 2 weeks ago on February 15th, we completed our first human trials right in the incubator at Velocity. We are proud to be part of the inaugural companies here at Velocity Health. I'm James, we are Cauchy Analytics, and we're hoping to be the future of medical AI.